Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, as I mentioned earlier, we have given everything in a very systematic order and I hope this will be very convenient for the continuous study. Since last class, we have been started with a new series of talks classes, so that is related to puberty and pubertal changes. Now here in this series we will going to discuss about different aspects of the puberty, physiology of the puberty, then pathology of the puberty. So when we talk about pathology of the puberty, mainly in the present scenario what we are encountering is a precocious puberty. Precocious puberty is a very important. Now in the last class we have seen the basic information regarding the puberty and what do you mean by mini puberty and how GnRH hormone will play the role, how hypothalamus will play the role and pituitary gland will play the role, and the peripheral target glands like adrenal gland, ovary, etc. will play the role. So this we have seen. So in this class we shall concentrate more on precocious puberty. Precocious puberty means if the pubertal changes occurs before the expected age, so then it is called as precocious puberty. We know that when there should be telarche 8 to 9 years, there should be adrenarche 9 to 10 years, then in case of the female there should be growth spurt, and this will be followed by menarche at the age of 12 or 14 years. This is a normal correct order which has to be followed if you are dealing with a normal case. Now if this is not followed, in the meantime, the time period is very earlier. Time is very earlier. That means instead of the adrenarche occurring in 9 to 10 years, instead of that, if the adrenarche is occurring in 6 or 7 years itself, then we will call it as precocious puberty. Menarche should be normally occur at the age of 12 to 14 years in case of females, and if it is occurring at 10 years or 8 years or 9 years, then definitely it is precocious puberty. Okay. So if the pubertal changes are occurring earlier than the expected time period, then it is called as precocious puberty. But this precocious puberty is of again two types. Now the point starts. Okay, this precocious puberty or the puberty changes which occurring, not exactly the precocious puberty, the pubertal changes which are occurring. So they are mediated by two important aspects. One is from the central and another one is from the peripheral. Okay. One is from the central. Centrally, what is bringing the pubertal changes? That is pituitary gland, hypothalamus, pituitary gland, and that axis. So that is bringing the pubertal changes. Centrally, it is going to produce the GnRH, gonadotrophin releasing hormone, isn't it? So that gonadotrophin hormone releasing hormone, so that comes to the peripheral parts of the body through the blood, and in the peripheral part, it is now activating the peripheral organs related to puberty, like adrenals, ovary, or testes, etc. So the work which is done by the central part of the this puberty, so that is from the pituitary gland, so that is called as central puberty. Okay, that is called as central puberty or centrally mediated puberty, whereas one which is occurring in the peripheral part, so that is called as peripherally mediated puberty. Similarly, when I am talking precocious puberty, pubertal changes are coming earlier. It may be because of centrally mediated causes or it may be because of peripherally mediated causes. So that we will go into discuss. So how we will go to discuss that? So that we will see through a case. Now, so this is a case, carefully look into this particular case. This is a 6-year, 5-month-old female child. Okay, 6.5-year-old female child, reported to OPD with the complaints of breast enlargement by the mother since last 2 years. So this is what his mother is telling, since last 2 years. That means when the child is 4 years of old, from the 4 years itself, so mother is noticing that her breast is a little bit enlarged compared to the other kids. And she developed early pubic hairs around 5 years of chronological age. In the meantime, she also developed pubic hairs around 5 years of chronological age. Now, the first thing is breast development. So, breast development usually occurs by 8 years of age. Okay, After that is called as telarche. That's what we are talking about, the order of pubertal changes. Telarche usually occurs 8 years of age, but in this child, telarche is occurring at 6 years. Mother is reporting, but she is telling that 2 years back itself it is started. So maybe 3 or 4 years earlier, the telarche has been started. Okay, maybe at the age of 4 year only, the primary changes of this breast enlargement like telarche, etc. So that has been initiated. Again, she is telling that pubic hairs are developed at the age of 5 years. Now, pubic hairs means pubic hairs and axillary hairs will develop only once the adrenal glands are get activated. Androgen secretion starts. Now, usually it occurs 9 to 10 years. Okay, but in this child, it is started at the age of 5 years. Okay, 5 years. Again, 3 or 4 years earlier, the changes are occurring. Similarly, she attained menarche at 10 months back. Now she is 6, so 6 years. So maybe around 5.4 years. Okay, about 10 months back, she attained the menarche. Now she also started with the she also started with the menstruation. So she started with the menstruation means her ovaries get activated. Okay, overall activation has been happened, and with the attainment of all the secondary sexual characteristics. Okay, so along with that, she attained all the other secondary sexual characteristics which required, like the changes in the labia minora, labia majora, then pubic pad, then pubic hairs, etc. Whatever the changes required for the secondary sexual characteristics, enlargement of the breast. Now she is on regular periods. Yes, now she is regularly, every month she is attaining the periods. There is no history of any headache. There is no history of any drug intake. There is no any midline effects or midline defects rather. Past history is not significant. This is the only past history what she got, and she is born by a term delivery with the normal perinatal and postnatal period. There is no birth history significant, nothing. Family history is normal. Okay. Again, BP is 110/62 now. Weight is 15 kg. Height is 97 percentile. Height age is accelerated little. Height is also increased. Now, baby is only 6 years of old. Okay, 6.5 years of old. 6.5 years of old baby. She already attained menarche. And all her changes, so that took place earlier. See, first there is a breast changes happened around the age of 4 years. Around the age of 5 years, the adrenarche happened. Around the age of almost all 6 years, the menarche started. One thing is very clear, everything is coming fastly, earlier to the expected period. Now we have to see, although it is coming earlier to the expected period, it is following that order of pubertal changes, isn't it? It is following the order. What is that order? Order is first telarche, then adrenarche, then menarche. Here also same order is followed. First she attained telarche, then she attained adrenarche, then she attained menarche. Now this is the case. So this is what we know. Usually the telarche occurs around 8 years, followed by the adrenarche. This will be followed by menarche, and these changes will always occur in a sequence in a normal scenario. Okay, so then it is called as normal. Now here the sequence is same. In this case the sequence is same, but unfortunately it is happening earlier. It is happening earlier. Now the question comes, what do you mean by central precocious puberty and what do you mean by peripheral precocious puberty? Now there are two types of the precocious puberty. One is central and another one is peripheral. In central precocious puberty, it is also called as systemic puberty. Okay, so changes which are taking place normally but happening little earlier. What I mean to say is, in case of central precocious puberty, the changes are happening place in an order itself, sequence itself, just like normal. But unfortunately it is happening earlier, as we have witnessing in this particular case. In this case, the changes occur in relation to the normal body physiology but in an accelerated phase, है ना, कि जो आना चाहिए 8 साल में वो इसको आ रहा है 4 साल में, जो आना चाहिए 10 साल में इसको आ रहा है 6 साल में, बट ऑर्डर सेम है. पहले telarche ही आ रहा है, then adrenarche, then menarche. Okay, but it is in the accelerated phase. So all the puberty changes are taking place in a sequence systematically. That is a different issue. It is happening earlier. So when we witness these type of changes in the puberty, so then it is called as central precocious puberty, because everything is mediated by the central pituitary gland. Okay. Now, what are the most common causes why the central precocious puberty occurs? Now, in common causes, if you see, some of the CNS conditions will be there. For example, suppose there is a tumor of the pituitary gland. Okay, pituitary gland has developed a granulomatous tumor. Okay, so it is developed a tumor. Now, that tumor is producing excess amount of the gonadotrophin hormones. Okay, so like a tumor is producing excess amount of the hormones, and that may be the cause, because हार्मोन का जो प्रोडक्शन है वो ही जरूरत से ज़्यादा है, इसलिए जो चेंजेस आ रहा है वो जल्दी आ रहा है, जहाँ पे 10 होना है वहाँ पे 100 आ रहा है. Okay, so that's one cause. It may be because of some infiltrations, it may be because of radiation effect, or it may be because of some of the drugs. Okay, some of the drugs, suppose anabolic drugs like steroids, etc. So they may induce this earlier. Now in girls, 90% of the cases of this precocious puberty are idiopathic. Now this is very important. I told that pituitary hormones, excess production like in tumors of the pituitary gland, radiation, some of the drug effect, some of the infiltration effects like something is coming and get infiltrated in the pituitary gland. So all these conditions witness excess amount of the hormone from the pituitary gland, and that cause an abnormal central precocious puberty. But if you see in girls, 90% of the cases of the idiopathic, 90% of the cases of central precocious puberty are idiopathic. That means there is no tumor, there is no history of drug, just like in this case. In this case, we don't have any history of tumors, there is no history of radiation, there is no history of intake of the drug, etc. But still, child has developed a central precocious puberty. So 90% of the cases are called as idiopathic causes. So this is called as idiopathic central precocious puberty. But before labeling it as idiopathic, okay, so we have to exclude all the organic causes. If no cause found suitable, then only it should be named as central precocious puberty. Otherwise, it cannot be. So before that, to do that, so what we have to do? We have to do all the possible investigations. Okay. Now, suppose if the child is IUGR, this child is normally born. Suppose if the child is IUGR, then there is always a chance of getting precocious puberty. This is one of the triggering factors. This predisposes precocious puberty if the child is IUGR. Similarly, the history of treatment of leukemia. If the child has got leukemia, because lymphoblastic leukemias are very common around 3 to 5 years of the age. So that time the radiation effects, radiation therapy, and many other things, drug therapy has given. Such babies are also known to develop precocious puberty. That is pubertal changes related. Okay. Now there is one more thing. Precocious puberty may be central and peripheral. Peripheral we have not seen, that we'll see later. Central we are seeing. This precocious puberty, it may be central or it may be peripheral. Again divided into two types. Yes, it is again divided into two types. One is isosexual and another one is heterosexual. What is this? Now see, isosexual means, now as we are witnessing this case, here the puberty changes are very fast, sequence is very fast, isn't it? And we have named it as central precocious puberty because it is occurring in an order. Now this central precocious puberty may be of two types. One is isosexual and another one is heterosexual. Isosexual means pubertal changes are very fast, but they are only related to one sex. That means, जैसे इस केस में, in this case, pubertal changes are very fast, but all are related to female only one sex, isn't it? For example, telarche happened, adenarche happened fast, then menarche happened fast. So pubertal changes are related to only one sex. Sometimes pubertal changes may be related to the both sex. What do you mean by that? That means telarche is attained fast. Okay, then that particular child development of the facial hairs. Now it is heterosexual. It is a heterosexual central precocious puberty. Okay, so like girls with the breast development and facial hairs, as I given the example. If there are mixed features are there, so that has to be studied further. Just for your information, I am telling, central or precocious puberty may be again divided into two types. One is heterosexual and another is isosexual. Now, if you look into this case, this is an isosexual central precocious puberty. Okay, in the meantime, if you go for peripheral precocious puberty, so that explanation of the peripheral precocious puberty is very important, which is nowadays very common also. So that we will go to discuss in the next class. Thank you very much.